I found what felt like a muscle. If you run your finger on your pinky, that's what it felt like. And I go in, they did the mammo, they did the ultrasound, and then the radiologist met my husband and I in this small room with 2 chairs to say, look at me in the eyes and say, I'm pretty sure it's breast cancer. Not the words you want to hear.
The tumor, it measured over 2 centimeters, and it was a hormone receptor negative carcinoma, which is one of the more aggressive types of breast cancer.
We decided that the best approach for her aggressive form of breast cancer was to treat her with a combination of drugs before the surgery.
I'm working side by side with those medical oncologists every day, so we can discuss specific cases and determine the best first approach for a patient.
My husband and I completely felt confident in the care that I was going to get here at Memorial.
They were well versed on everything that needed to be done, and just not having to worry about that was the support that I needed from the hospital system.
Her tumor started to respond early on in the treatment, just weeks after starting. We monitor her progress through the treatment phase that took about 4.5 months or so.
I assist the patients in getting all their appointments, creating, maybe helping them in community services, some resources that they might need.
And first she called me, she was like, you got this, we got this, you're not alone in this. And those words helped. And I would ask her about what people experience while they're going through chemo. She actually recommended that I go to the integrative medicine doctor, Dr. Mehta here. I like that natural route too. Then he recommended some really good information. She really is my angel, because what she did for me and my husband to talk us through things, walk us through things, guide us through things, just helped tremendously.
When she came back to see me, I could no longer feel the tumor because the chemotherapy had essentially melted the tumor away. She had decided that she wanted to have both breasts removed, so bilateral mastectomies.
June 30th was my double mastectomy and reconstructive surgery. They took 2 lymph nodes on my left, and there was no sign of cancer.
She had a fantastic recovery. Honestly, throughout treatment, she was phenomenal. It's patients like Shamena, it makes it so rewarding. And you know, when we do have such a good outcome, and you know, knowing that she has such an excellent prognosis, that's why we do what we do.
I was just the coach, she was my fighter, and she succeeded.
With Memorial, we kick cancer's butt.